what I'm hearing you say is that elsewhere in every other industry, whether you are a text message going back and forth, whether you're Amazon trying to talk to whatever you're trying to do, you're going to pay 10, 15 cents for 1,000, whatever data you're transmitting back and forth in order to do commerce. In this particular case, you're paying that 10, 15 cents per. That sounds nuts.
Yeah, it's completely out of whack.
Is there something special with healthcare or something like that that would account for this?
There is a lot that's special about healthcare, but it actually should work in the opposite direction. The things that are special about healthcare should make it cheaper. HIPAA, most people know of HIPAA as a compliance and privacy framework. It also did, among other things, establish something called the Administrative Simplification Rules, which mandated that all the parties in healthcare use a set of standardized transactions, which are known as X12, but that's not super important. Standardized the eligibility check, the claim status, electronic remittance advice, which is the information about the payment that came back. And it said that everybody has to follow this specification exactly. And so, yes, the specification is lengthy, so it's complicated to build out. But what that means is that the transactions functionally look the same. And yes, there's payer-specific differences, but when you talk about the difference between one of these two payers' transactions versus Amazon versus Walmart, it is a much, much narrower set of data that you have to work with. So within that, there's also all these wonderful things, which people on the podcast might think this is strange to call these things wonderful things, but like ICD-10 codes and CPT and CDT codes and HCPCS codes, which are, yes, there may be cumbersome lists to maintain, but they are lists. They are things that everybody has to conform to. And we would have killed for things like that in retail and logistics that say, look, for this particular field, here's what everybody has to use.
So it's so interesting what you're saying that, I asked if healthcare was special, immediately thinking that you were going to say, well, healthcare is more complicated. And therefore, maybe there's a rationale for why healthcare transactions should cost 1,000 times more. And actually, here we have the opposite. Like, we have all this set up already. You're using the same electronic data transmission language. You've got lists of things, like a code is a code. So yeah, that was unexpected.
And look, I think people often get the concept of simple versus complicated or complex versus standardized confused. Yes, things are indeed very complicated in healthcare. They're very complex in healthcare. There's many dimensions to it.
What I'm hearing relative to this 10 to 15 cents a claim transactions that adds up to billions of dollars a year. You can say a lot about HIPAA, but I guess this is a plus. Healthcare is special in a good way. And yet, oddly, and maybe this is foreshadowing, oddly, it's 1,000 times more to send a transaction.